Hi, good afternoon, everyone. Welcome back to another episode of Healthier You here at Oswego Health. We're so glad that you joined us today. This month, we're going to focus on senior care, and we know that we have a population that's aging, and we wanted to talk to you a little bit about what to do as you are caring for someone who's aging, or if you're aging yourself. We got some great tips for you today. I'm here with an expert panel. I wanted to welcome them. I'm Katie Peglaroli, Corporate Director for Integrated Healthcare here at Oswego Health, and I'm joined today by Jason Santiago, who's our VP and Chief Operating Officer, Seneca Hill Manor and Springside at Seneca Hill. Amanda Saternow, who is our Long-Term Care Community Liaison. Jeff Hopp, who's our Director of Oswego Health Home Care, and Keith Waldron, who is the Rehab Coordinator for Oswego Health Home Care. Thank you, everyone, for joining me this afternoon. And our community, we're glad that you're joining us as well. Jeff and Keith, I'm going to start with you. So as we get older in age, it can be sometimes tough as people are aging and they need to go for care, either routine care or care that they need immediately. And that's where maybe Oswego Health Home Care can come in with immediate needs. What does Oswego Health Home Care provide to our community?
So home care's focus is really on keeping clients in their home. We offer a wide range of services from nursing, physical, occupational, and speech therapies, as well as registered dietitian and social work. And as a collaborative team, we can come into the home and provide high level or high skill, such as wound care and stuff of that sort, or basic education and some restorative therapy to establish or maintain a baseline to keep a client in their home.
And that restorative therapy really does involve a multidisciplinary team. We have physical therapists on staff and occupational therapists, as well as speech therapy, nutrition, and as Jeff said, we've got some social work involved too. And for those folks who may not be familiar with the difference between physical and occupational therapies, the way that I like to try to characterize it is that physical therapists, especially in the home, they're the ones who focus on how to get you into the space that you need to be in. An occupational therapist are then the experts at helping you learn how to do what it is when you need to get there. So for instance, if you're in the living room, it's the physical therapist who helps you get out of your chair, get into the kitchen, and it's the occupational therapist who would then assist in any type of interventions that would help you in food preparations or managing dishes or things of that nature.
That was a great explanation. Thank you. So question for you before I jump on to Amanda here, but if I wanted home care, if I know someone that might need some of those services that you were talking about acutely, how would I go about getting that home care?
So all of our services are overseen by a provider. There needs to be a doctor to give us those orders. And our referrals can come from a primary care physician or even a hospitalist after a stay in the hospital or a rehab facility. So if you are in the community and you wanted to establish home care, the best avenue would be to talk to your doctor to make that referral.
Great. Thank you so much. Okay, Amanda, big question here. As we right now are fall headed into winter, and we know some of those tasks of owning a home can get tougher as someone ages. What are some of the benefits to looking for an alternative living arrangement or downsizing to a cottage, such like we have at Springside or Seneca Hill?
There's lots of benefits, Katie. That's dreaded snow removal is one of them. We offer all your lawn care services, all of your maintenance, your interior and exterior maintenance, appliance maintenance, trash removal, water, sewer. There's no more property taxes, all sorts of different positives there.
Great, thank you. Jason, now to you. This is as we, want to keep people in their home, and Amanda just gave us some great reasons to look at maybe downsizing. But sometimes people need that little bit more care, and entrusting a family member to a skilled nursing facility or nursing home can be very difficult, but it could be easier if we know what to look for. So we have a loved one, they need some care. What do you have suggestions on what you could look at when trying to pick the right facility for your loved one, such as Seneca Hill Manor?
Sure. Thanks, Katie. Yeah, I mean, it's never an easy decision when you're trying to find a place to place a loved one in a nursing home. But I would say, right, the two things that come to mind right away are quality and safety. you want to make sure that you're putting your loved one in a safe place, but also a place that is high on quality. And you can find those things on Medicare.gov. Medicare.gov, they have a nursing home compare tool, and you can look at the quality ratings for nursing homes. You can also see inspection ratings for nursing homes. It's public record. That gives you kind of some additional insight as to, the type of place that you might be possibly placing mom or dad. Another thing I would highly suggest for anybody looking for a nursing home is also ask to tour the facility. I mean, that also can give you a visual picture of the facility. And when you tour the facility, look around, ask questions. You can tell when you're in the facility, are staff happy? Are they attentive? Do they seem engaging? I think that helps paint the full picture as to, when you're looking to place mom or dad in a nursing home. And I think that could help you with making that decision.
Great. Thank you so much. Okay, Amanda, we have a question. I'm going to point to you. If I wanted to consider joining a community like Springside, what would be the minimum age requirement?
Our minimum age requirement here is 55 and up.
55 and up. And again, Jason just mentioned touring. I'm certain that people could also get a tour and connect with people to kind of see what those apartments look like. They have some different options for living there, right?
Absolutely. Absolutely. We're at full occupancy right now. So we are working off of a small waiting list. But we are doing tours all the time. So our doors, are still open for that. We're taking all the precautions with COVID, but we're still welcoming people that want to come take a look at our campus to just give us a call and we'll set something up for you.
Great. Thank you. All right. I think that's the questions that have come in so far. This has been so informative as we have talked to our seniors today, anyone in our community who is managing, maybe someone who's aging. I wanted to thank you guys for joining me this afternoon. Also, if you didn't get to catch this, you can rewatch it. You can also check us out on our YouTube channel. We hope that we've answered a few of your questions to help improve your health and wellness, and we'll see you next time here right at home.